Good afternoon to one and all. I'm Dr. Shubham, Junior Technical Officer from Board of Ayurveda, NCISM. On behalf of NCISM, I welcome all the principals and Ayurveda faculty members joining today from locations all over the nation. As we have all known that NCISM is celebrating its Foundation Day on 11th June every year. And as a part of fourth Foundation Day celebration this year, NCISM is organizing series of online and offline programs for the benefit of stakeholders of ISM. Today, we are starting it with our first online program on educational transformation for competent Ayurveda professionals. Before starting the program, let's pray and have blessings from the Almighty. गाइए गणपति जगवंदना गाइए गणपति जगवंदना शंकर सुवन भवानी नंदन शंकर सुवन भवानी नंदन गाइए गणपति जगवंदना सिद्धि सदन गजवदन विनायक कृपा सिंधु सुंदर सबलायक मोदक प्रिय मुद मंगल दाता विद्या वारिधि बुद्धि विदाता गाइए गणपति जगवंदन मांगत तुलसी दास कर जोरे बसहु राम सिय मानस मोरे गाइए गणपति जगवंदन गाइए गणपति जगवंदन गाइए गणपति जगवंदन. Thank you. Now, I request Dr. Atul Varshney, Member Board of Ayurveda, for welcoming address.
Thank you, Dr. Shubham.
Ji, sir. There is some issue.
Yes, Am I audible? Yes.
Yes, sir, you are audible, sir.
Respected Chairman Sir Jayantdeep Pujari ji, respected Professor B.S. Prasad Sir, President Board of Ayurveda, all the presidents and members of NCISM, and all the ladies and gentlemen present in this occasion. Good afternoon to all of you. It is my great pleasure and honor to welcome you all to this significant lecture on education transformation in Ayurveda education. Today, we have the privilege of hosting a distinguished leader in the field of education, an individual whose vision and dedication have significantly shaped the landscape of Ayurvedic education. Please join me in extending a warm welcome to the President Board of Ayurveda NCSM, has been a beacon of knowledge and inspiration for both students and faculty alike. With a profound understanding of the ancient wisdom of Ayurveda, combined with a forward-thinking approach to modern education, he has continuously strived to bridge the gap between traditional practices and contemporary educational needs. Under Prasad Sir's leadership, NCSM has seen remarkable growth and innovation. He has championed initiatives that integrate technology with traditional Ayurvedic education, ensuring that our students are well equipped to meet the challenges of the 21st century. Prasad Sir's commitment to fostering an environment of academic excellence and holistic development has truly set our commission apart. Today's lecture promises to be an enlightening exploration of how education is evolving and how we, as educators and students, can adapt and thrive in this dynamic landscape. We are eager to hear Prasad Sir's insights and learn from his wealth of experience. Without further ado, please join me in welcoming Prasad sir to share his thoughts on the transformation of education. Thank you.
Namaste to all of you. And, thank you, Dr. Atul, for welcoming all the gatherings. And Honorable Chairperson. Am I audible?
Yes, sir, you are audible, sir.
Honorable
I-
Chairperson of the NCASM, Vaidya Jain Dev Pujaraji, my fellow presidents, Dr. Jagannathan, Dr. Raghuram Bhatt, Dr. Rakesh Sharma, and all the members, honorable members of the NCASM, and all the honorable principals of all the Ayurveda colleges, and all the respected teaching faculties of all the colleges of across the India. I am very happy to be part of this fourth Foundation Day celebrations of NCASM. In the June 11th of 2021, the commission was notified with 4 presidents and 1 chairperson. Now we took the charge and in a very small, humble way, and then our journey began. And we have completed 3 years of this time. And I'm very happy to be the third year, 3 years of the tenure, and in the fourth, the Foundation Day celebrations. It gives me immense pleasure to be present again to share some of the ideas with all of you. And at the juncture, I must thank our Honorable Chairman for his able guidance in shaping up the so many activities, and also many people who contributed a lot to the developments what we undertaken is all these ones. And at the same time, let me share my presentations so that I can discuss some of the ideas which I want to share with all of you. Is it visible? Slides are visible?
Yes, sir, it's visible, sir.
Is the full screen?
Yes, sir.
Yes, sir.
Yes, okay. So the educational transformation for competent Ayurveda professionals is a part of the fourth Foundation Day. As I told, 11th June is our Foundation Day. And this time we are organizing very series of activities, some online programs and then offline program. Today is the first day of the activity where Board of Ayurveda is presenting the talk on educational transformation for competent Ayurveda professionals. And then on the 5th, Dr. Jagannathan will be speaking to Unani Siddha Savarika presidents and staff. And then on the 6th, we have 2 talks by Dr. Rakesh Sharma and Dr. Raghuram Bhatt. And then on 7th, we have 2 talks by our Honorable Chairman for the UG students and PG students. And on the 11th and 12th, we will be holding a national conference by name Prana. All of you might have received already. And I'm happy to say that we crossed the registration more than 500. And it was very huge response was there. And then on 11th and 12th, very unique conference on the Prana, that is protecting rights and privileges of the rights and novelties of the ASUS professionals that is going to be held there. Anyway, coming to today's topic, educational transformation for competent Ayurveda professionals. So, why we need to reform? There is the main question comes here. When it is already going on, many people say Ayurveda is going on well, it is very old system and tested system and everything they say. So what is the need of the transformation or reforms? So as it is told, Kalohi Parinam Uchyate. There is change or modification is the nature of time. During course of time, everything will undergo a change or modifications or metamorphosis. And we can see in this also 1970 we have IMCC Act and 2020 we have NCSM Act. There is the total shift of the act itself happened. So there is a need to change, a reform, a transform, so many things. And then when you see the past, for example, Ramayana time when you see, there is most of the Daiva Chikitsa was there. Ramayana time, Putra Kameshti Yaga was done there. When during the Mahabharata time, this was technology. They were using the artificial intelligence, the artificial insemination, donor insemination, and then even the test tube baby concept also there during Mahabharata time. Likewise, there is a total shift of the Ramayana to Mahabharata time from the Daiva to technology interventions were there. Similarly, the documentation as a system. In the Gurukula time, we have oral transmission. It was only memorization was there. Later on, we have the written manuscripts. Then we have hard disks, hard drives, etc. Now we have cloud storage. Likewise, during course of time, everything there is a evolution, there is change, there is more metamorphosis happening at every time. When you see about the chronology of our development also, here Dayapasraya to, I'm sorry, Dayapasraya to Ikthyopasraya, then herbal medicines, then we want mineral medicines, and we have now the extracts, dosage forms, etc. going on. Likewise, the time to time, there is a change is going on happening. In the medical process, medical practices, medical knowledge. Similarly, our education system from Gurukula to Kulaguru system. We have the Gurukula system, Gurukula was there, and then now we have Kulaguru system. There is university system pattern has been practicing now from that. There is a total shift from the education system else. And it is told today's innovation, tomorrow's tradition. For example, blood sugar. Earlier, we used to get prescribed or we used to prescribe to the test and the patient to go to laboratory and get test blood sugar. But today, every household has a glucometer. No longer, now the doctor cannot prescribe only blood test. Now they have gone to the higher level, HbA1c they prescribe. Similarly, presently, Ikatubasti, Janabasti, Griyavasti, etc. are Panchakarma theatre procedure present. But tomorrow, some the equipment already working out, people are working out. When they come into market, it becomes a household practice tomorrow. So that is way, and then we need to upgrade ourselves to the higher level of the therapeutic procedures, not the common levels. That way, we need to think the time during the course of time, with the things will change, and we have to be ready to accept the change, and we have to develop ourselves to the next level of the competencies or practices, whatever things are happening in the society or the science. Now, the need of reforms, one is positive of expansion or development of communication. One is the Samhitas, when it was written, is not communicated to us in the same fashion how it was written. Same way, during the course of time, we have Samhitas. Later on, there is no expansion. For many centuries, we could not able to add to the literature, not able to add to the science of the Ayurvedic science. It was a stagnation there. Then during course of time, emergence of alternate or multiple features. For example, at that time, Ayurveda was only one medical science. But now we have plenty of medical sciences are there. Allopathy has come, then homeopathy has come, then Unani, Siddha, Savar, Ikpa. Likewise, we have several medical systems are there, the parallel which are developed there. Earlier, it was only one. Now we have several systems are there. Now emergence of new subjects, genomics, necropharmacology. Likewise, we have several newer things has come, which we need to imbibe into our systems so that to the contemporary science, we can have the upgradation for our own subject cells. The same way, change in the career circumstances, so where we have now busy lifestyles. For example, now the employee or the even students starting the elementary school up to the employment. Everyone have different schedules are there. Some will have morning 7:30 only. Some will have night shift are there. Some will have afternoon shifts are there. Likewise, for example, when you say think of the Brahmi Muhurta practices. So now which time the people are getting up, when they're going to bed, totally change. The shift is there. Now we need to think of how we have to bring our principles into practice again. We need to rethink of those ones. What is the way how to bring into practice? But they're definitely useful. They have to be implemented, but in the modified way to suit the present days the lifestyles we have to think of. Similar way, shift from the malnutrition, infections to overnutrition or lifestyle disorders. Now we see the weather, we have overnutrition. People are eating, and so they have overnutrition and then lifestyle disorders. Earlier there was malnutrition, infections are there. Now infections came under control because of hygiene education, whereas malnutrition also improved, whereas overnutrition and life disorders are increasing now. Again, we need to think a lot for that also. The change when there is similar way, speedy recovery. People want speedy recovery. They shift from curative to preventive and promotive. The corona has taught us, so we need to think of from the curative to preventive and promotive. The people are, can I remove this one? 1 second. So they shift from the curative to preventive. Corona has taught us them. We have to shift from that one. And then similar way, the technological advancements. The software, gadgets, or medical practices. Now people are having how many steps they walk it, how much energy they spend it. Like when the wearable gadgets has come there. Now we need to incorporate into them into our the practices also, and how to blend our fundamental principles in those concepts and how to use them. That way we need to think of. So all these reasons for why we need to think of reforms. Without reforms, without restructuring, without transformations, we cannot adopt all these changes and developments in the society happening. Now the mandate, as I told, 1970 IMCC Act, now 2020 NCSM Act has come. So what it mandates is supplemented with knowledge of scientific and technological advances in modern science and technology. There is one part. So we need to update our science to the extent of scientific advances happening in the scientific field. There is one thing. Second one is develop competency-based dynamic curriculum at all levels, UG, PG levels, whatever levels we have, all those levels, we should be able to develop competency-based dynamic curriculum at all levels. That is the mandate given to the NCASM. So we need to again work out these ones. For that, we have to reform. Another major the observation of the issue, everything we dump in UG, no difference between UG and PG syllabus contained. This is what is happening. As I told, samhitas are they're just stagnated now. It is not expanded further. So what we do is maybe one samhita is there. The same thing we teach in the UG also. The same thing we teach in the PG also. And so we are unable to maintain the different levels of the competencies in the UG and PG. And so we don't have the referral system also in our science. There is no reference between UG to PG. A specialist, he says he will treat everything. He has to treat everything because we could not able to maintain the competency difference because of the lack of information or whatever way we have the level could not able to maintain it. We are dumping every content into the UG itself. Now we need to think of the different competencies and we have to show the differences. We had a survey from the students, around more than nearly 2,000 students has participated in that survey. And then there, what it indicates, are you satisfied with the content of syllabus curriculum of Ayurveda? More than 50% says no for it. There is a negative answer, but they're not satisfied. They want modifications. And then, do you feel that there is a need to create an army of teachers capable of teaching successfully, as even teachers require training to adopt a concept of the concept-based research approach? So there is a more than 90% of students says yes, the teachers has to be appropriately trained. That was the teacher students feels. That indicates again our teachers are able to meet the next generation requirements or the expectations of the students. Next question, do you think that concepts and practices of modern biomedical sciences like biochemistry or etc. should be taught in BAMS? More than nearly 80% students says yes, they wanted the newer advances in the scientific field. They want to be taught. Next question, do you feel it is necessary to add more clinical teaching hours in the curriculum? Again, nearly 70% of students says yes, they wanted the more and more the clinical teaching hours in our curriculum. So that we nearly 70% of students. So these are the few of the questions. There are around 56 questions are there. I have kept only a few questions only here for example purpose. Otherwise, time is not permitting to us. Next, we had a thought experiment. We asked the teachers actually where we want to restructure the postgraduate course and done so much of ambiguity is there that we want to clarify. So we floated a Google form for the thought experiment. More than 12,000 teachers responded for it. And however, when we see the results, what I understood is there is no clarity among all these ones and even no consensus also. So the diversified opinions is coming and diversified thoughts also coming. That indicates the clarity. We need to bring the clarity in the postgraduate curriculums also, and also to bring the consensus among the same specialty teachers also. There is not lacking. There's the overall, because the result time is not there. We can't give the result, but overall the impression of the thought experiment. Then what is the scope now? In which angle we have to think of? So Ayurveda, India's soft power through which India can become a Vishwaguru. That is our government of India's expectation also. Even Honorable Prime Minister Narendra Modi ji is promoting the Ayurveda very well along with the yoga. And they feel, government of India feels it is a soft power of India. And so India can easily become a Vishwaguru, or we can be the global leaders in the medical field through our Ayurveda when we promote appropriately. So that way, there is a huge scope for our science to become a globally. And then our Prime Minister promotes heal in India, heal by India. I think already we had activities, many principals are already involved in it. And we have shared to the colleges, 2 PPTs are there, how to promote our own people for these 2 activities. We had a meetings also, and some of you are aware of these ones. And Ayush Visa, recently we have circulated the communication also, how they can register also. So these are the initiatives taken by Government of India, where we have huge potentiality to encash or to they get benefit of the schemes there. So that way, again, the Ayurveda have tremendous scope in the coming days. When you see the industry, and it was 20,000 or 697 crores in the 14-15, whereas it cost the 1,37,800 crores. It cost the 6 times of the, yes, during the COVID time, it has crossed to huge the transformation, more than 5 times, 6 times. It has crossed this one. That indicates the potentiality of the industry and economy in Ayurveda sector, where we can think of investing or the concentrating on the Ayurveda growth. And further, recently we have seen that when medical insurance coverage has been mandated to all the insurance companies, and the Government of India, Honorable Secretary, took the sensitization program the 1 week ago at the Organization of Ayurveda to sensitize all the insurance companies, including the overseas insurance companies also coming forward to reimburse the expenses for the Ayurveda treatments through the insurance coverage, which is a big boost for our sector also. And then now we are expanding the horizons to the Vriksha Ayurveda and Mruga Ayurveda. So that way, so there is a huge potentiality for the system to grow enormously. And again, country to country MOUs the Government of India had, where we again huge scope for the expansion to the globally. And all of you may be aware that one. And the Government of India signed with the WHO for the establishment of the Global Center for Traditional Medicine, GCTM at Jamnagar. It is coming up in a bigger way. Again, a huge scope. And this is the G20 summit. This is called Gujarat Declaration. It has been labeled. And then ICD 11, the International Classification of Diseases 11, in which there is a second module of traditional medicine, is again a big boon for our systems, where in the International Classification of Diseases, our terminology is entering. That is a big one. And recently, it was launching was there. And now NCSM is planning to hold the capacity building programs for all the colleges, how they can implement the ICD 11 in the diagnosis. That is in the regular hospital diagnosis. There is one going on. We'll be shortly conducting the orientation program for that also. And then now we understood the problems, as we know the scope now, and what and how to transform. That is the major things comes now. And to make the competent syllabus or system, how to produce competent Ayurveda professionals. For that, what we have to change. So these are the few of the aspects which we need to think of. Infrastructure in terms of building, as well as the equipment, etc. And human resource, not only teachers, all sector of the employees of the institution. Then curriculum and syllabus, the main tool for the training of the students, and policy and administration through which the institutes are being administered, and the interdisciplinary approach, which we poorly lacking. always say this example. For example, X-rays to be invented or MRI, CT. If medicine and physics don't join together, you don't get the innovation. So there is a need to approach or embrace the allied sciences so that we can go for innovation. So we always want to encourage interdisciplinary or transdisciplinary approach among our people. This is a very, very important area. And the new initiatives, what all in NCSM is taking. So under these headings, I'll be telling you what the transformation has taken place. So the basis is consultative meetings. We had a meetings of several category of people, some experts, various the peoples we had meetings are there. Then we conducted survey, as I told, the student survey was there. Thought experiment was one of the survey. Likewise, some surveys were conducted. Then experiences, my own experience, and then many experts will come here, and by interaction, we got the experience of several senior most people, young people, all category of employees, say professionals, we got the experiences. And the advancements in the field, medical field, especially medical field, what advancement is happening there, which we need to incorporate, which we need to adopt, those all things we thought of. Then present requirements, what the changed requirements are there, those things also. And then requirements for 2030, what will be our graduates has to face by 2030, and then beyond that one, that again we thought of. Then contemporary sciences, in the medical science, the existing science, what exactly has been showing, what the level of the growth happening there, how we can be equating with that one, equally we can grow that way, and the global standards. So these all the kept as the base part of the transformation of the reforms which be taken up. And then we mainly worked through MSc, that is the Minimum Standards of Education 2022, which were notified in February 2022. And then the MES, recently we notified Minimum Essential Standard 2024 also, and other regulations and guidelines were all the time to time we are bringing out. All those ones, they bring out the transformation. Now coming to infrastructure. The infrastructure in the two ways. One is expansion of modification of existing only. In the existing itself, what we have to modify or expand that one. And then new initiatives. In the two headings I kept here. One is the classrooms we made as ICT enabled classrooms with 20% additional space that was there. Of course, these are what the newer college setups are going to establish now. And then demo and practice stations for Rachana and disease detection facility. So there is a major thing. So what happening is in 100 students batch, the 50 students go to Rachana and 50 students go to Kriya. And 50 students, many times, maybe even two bodies also there, 25 students or 50 students at once. There'll be some teacher is dissecting. Again, his head will be obstructing. All the students are surrounding that one. You can imagine now how much they can visualize, how much they can see that one, what is being dissected, which part is being dissected, etc. There is almost all, it's very, very difficult the situation where students cannot able to get exposed of. Then we brought them demo and practice stations, where a demo station where we have CCT, closed circuit TV will be there, and where the practice stations, there will be a small group, even not more than 10 students per station. They will be there. They have the TV there in front of them, and then where the teacher is what she dissecting, even a small part will be said where the students can easily see. Every students can see that one, and they'll be having that particular part only, so they can again dissect it, and they can get a proper exposure. So that way, the demo and practice stations are very, very useful for the students to get a clear exposure of what exactly being shown by the teacher or the dissection to be done it. And similar way, e-dissection facility, and some colleges can have 3D, the 3D dissection table can also have that one, but we made it mandatory of e-dissection facility. And then advanced laboratory equipment. Now we can see that one with the golden days, the microscopes, student microscopes are there, which many times we cannot see very clearly what is being the slide containing, and then very difficult there. Now again in that one, even you good microscope also, we'll generally have it of that one at the 9 o'clock position, you see a polymorph is there. That is one of the demonstrations. By the time student sees, sometimes that will move it and monocyte might have come there, or something, even the another cell might have come there. So the students will see that one only. What teacher is being shown, what student is seeing, there is no control over it in the microscopes. That is the reason we invested trinocular microscope, where you can have projection is there. A teacher can keep a slide and can demonstrate on the screen Every student can, without any mistakes, they can say it and then they can practice it. That way, the teaching and practice become the synchronized. So it becomes a effective teaching. So that is the reason we brought trinocular microscopes there. And Nadi Yantra is our technological advancements. After a long time, we had one advancement at least. So we want to incorporate that the technology into our the regular teaching. We have included Nadi Yantra into these ones. And we have new initiatives. For example, Yoga Clinical Skill Laboratory. In the present context, patients are not allowing the students to practice everything on that one. For example, PR examination, PV examination, even the suturing, dressing, all these are very, very important skills are there, which we need to train the students effectively. So the clinical skill lab will help a lot, which is Sushruta's concept is there, now become very essential now. And then we have introduced the clinical skill laboratory concept also. And again, the subject wise, we demarcated the what equipment to be done there, how to be done there. That is the one part, very important aspect has come into the practice. And then HRDC, that is Human Research Development Cell. As I told, not only teachers, we need to think of up to security. Every sector of the employees has to be trained. Then only you are going to get the quality 360-degree approach improvement in the institutions. We can't neglect all the any employees. Only we think of many times the teachers, the nurse, and Panchkarma therapist we think of. Remaining all we neglect it. So, but every employee of the institution is important to have maintain the quality of the institutions there. So we need to think of that is the reason we propose HRDC where we can be done it. Then research innovation and entrepreneurship development cell. Some of you teachers might have gone to the Hyderabad for training, which is a very wonderful training is going on for the teachers also. So there are many students or teachers having innovative ideas, but they don't get a platform for them to exhibit it. So we have research innovation and entrepreneurship development cell. A coordinator will be there where they work for their thoughts. It can be nurtured. It can develop into the good scientist can be developed through that one. So that way, this cell is become the placement now. And then maintenance and IT cell, which is okay. Introduce screening OPDs very long back there. That is important there. Because when a patient walks in, he don't know where to go, which doctor to consult it. So we need to guide appropriately, take history, and then we need to guide which specialty has to go, whether he required the Kachikicha consultation or Shilya consultation or Komara consultation. There is a duty of the hospital to direct the patient to the respect to appropriate doctor to that one. He's not going on changing. So I put here, not there. It is not the patient problem. It is our problem. Otherwise, patient also will waste a lot of time going to here, again coming back, going to again queue. A lot of problems are there. So it is the duty of the hospitals to make the screening OPD. And the digital library and language lab. The language lab, now the Sanskrit teachers, they're already being trained there. Now they can understand the importance of Sanskrit or the Sanskrit language lab. So how to pronounce it, how to usage. So language lab is very, very essential to get the accent also, the proper way of the pronunciation, all these ones, they'll be very good. Otherwise, all of you know that when sometimes we by heart a sloka wrongly and we can't able to correct them again appropriately because of the practices of the sloka by hearting. We cannot change which are by hearted already. So we need to have appropriate pronunciation for that language lab, very, very essential. That way we have to use language laboratory. The nutrition laboratory. Now, Swastha Vrutta, many times in the hospital, we say Manda Paye Vilepi, but many hospitals will never get the Manda Paye Vilepi, but we ourselves don't know whether which country is a carbohydrate or only or protein only or which one is it. So we need to have nutrition laboratory so that we can assess our own pathyas, what exactly they are there, how they are there. And point induction facility for the internal quality assurance cell. To improve the quality, we have to assess ourselves. What is our quality, where we have to stand, where we have to go. So that way, this also makes very important the cell. And then coming to many things are there. I did not discuss it. Record room, then ICU, because medical record room also, being a teaching hospital, we have to have records with us. And then now we have assigned Swastha department to the work out on the medical records to extract the epidemiological point of view. How the maybe which area, which type of diseases are there. So that way they have to analyze the data. So that way we assign them. So for that medical record has to maintain the hospital itself. So we need to maintain the medical records, and then Swastha department has to analyze the data appropriately and bring the leads in that one. That way, ICU, NICU, and then counseling cubicles. Even for the Swastha Vrutta, healthy people lifestyle counseling, where to do it? In the OPD, it take a lot of time. But one patient counseling may take, not a patient, he's a client only. It may 1 hour it may take. So only 1 hour OPD is not possible. So we had to have multiple cubicles so that one will be going on counseling at different areas. OPD will not be blocked there. That way. The Kriya Kalpa, Nushasya Karma, they are very important for all of you know that one. We need to have separate section for it. And what procedure room? Panchakarma theaters, for example, maybe by 2, 3, 4 o'clock they may close. Therapist may go it. Again, evening or some evening time also, Valaka Sveda to be done there, some other procedure to be done there, or Pichu, Lepa will be doing, some evening procedures will be done, pain management. Likewise, we may require round the clock some procedures in the wards. So we need to have a ward procedure room. Even Shelya people, they have thread change, pack removal, the drainage removal. So many small works will be there, which cannot be going to the taken to the OT every time. They need to have a small procedure room adjacent to the ward. Therapy diet, as I told, Mandape, Vilepi, we prescribe, we tell it, but we don't make available in our hospitals. It's very, very bad thing for us. So we made mandate of Patya department should be there, and we have to supply Patya to our patients. That is only right practice. Otherwise, half only we are practicing. That way we need to have. Likewise, the many procedures, etc. Online consultation, for example. This is again very important area, upcoming area. We have to have online consultation, etc. And then clinical classrooms. So we are all habituated to be in the ward only to clinical classrooms, but it is actually unethical practices going on. We could not take in only in the ward only. And again, there is limitations. We can show only the patient condition only at that time. So they are that condition will not be able to show to the patient there. So we need to have clinical classroom where with ICT enabled so that we can show complete spectrum of the same kind. For example, one sign or symptom is there. There are other minimum to maximum how it looks there. A lesion, by different lesions, how it looks there. Likewise, it can be a integrated teaching can happen there in the clinical classroom is there, where one X-ray you show, then with the normal X-ray how it looks, different X-ray how it looks. Likewise, we can show different X-rays also simultaneously. Likewise, the clinical classroom concept helps a lot for a comprehensive way of clinical the conduction and the clinical exposure helps a lot for them. That way, it is very important to establish. Now, coming to human resources, there the major requirements are there. The one is required number. So in the areas where, for example, Shelya department is there, they have to look after the OPD, then OT also, then ward also, then the theory class, the clinical classes also. And there is a 6 month, 2 batches will be there. So there is a huge burden is there for the departments there. So that way, wherever required, we have increased one number, we have made that also. Then physical education director, also we have separated. And then separate medical superintendent. Many times people think that principal is the medical superintendent is there. But principal go to half-day college, and then the hospital require a 24 hours monitoring of the hospital. The big establishments are there, and round the clock there is requirements will be there approving. So there is a to improve the quality, we require a full-time the person there to look after and the improvise and to face all the issues are there. So we require a medical superintendent. And then interdisciplinary approach, as I told, we have to have the contemporary sciences growth or to incorporate. So we had a BAMS with MS anatomy, MS physiology, Ayurveda, MPH, MBA hospital administration. This is all incorporated so that we can get those skills all we'll be getting to the system also. And capacity building, 360-degree approach, as I told, to all employees has to be trained through HRDC. Now, what all we are doing now? The principals conclave during World Ayurveda Congress, that's the first one we did it. And then educational planning administration, principals for the principals. Now today started, 13th batch has already started. It is a very good program is going on. We could be able to find out the National Institute of Educational Planning and Administration, the deemed university, where we had MOU with them. And they're conducting very professionally to the principals. 5 days residential program is giving very, very good results. Some of you already undergone the training, have experienced it also. I'm happy that many principals has gone to the colleges and presented there, even to the management they presented, and then they convinced the management how to develop it. That way they are doing very well. There is given a very positive sign as given. And similar way, our postgraduate scholars, they are one who is going to shape the PG students who will be next the teachers or researchers or clinicians. Unless until these PG guides are empowered And again, next coming postgraduates will not be with good quality. Thinking that one, what we thought is we want to orient all PG guides on scientific writing, publication ethics, and research integrity. So in this one, what we thought is to train again the thousands of people is not very easy task. So then we thought we'll make a master trainers with uniform the training and capacity, and also we'll prepare uniform standard PPTs are there. Then through these 60 people, we train across the country. So that was the main area plan. We did the 60 people training at the Pune University. It was a very good program done it. And then now we have started the program. Already 4 programs already over. It is going on very well with good appreciation. I used to get the feedback from the every college. General College has also had a direct interaction with them. We had a review meeting. And then with Hassan College also had a discussion with them. And then now the work is going on different areas. So it is going very, very good result is be giving that one. And then as I told, entrepreneurship development also. When we did a survey, around 410 people of our professionals are having either patents or applications applied for patents or having patentable material with them, developed material. So the hand holding them is very difficult. We need to do that one. So that way we thought entrepreneurship development, we have to do the capacity building. We could be able to find out NIMSMU at Hyderabad. We had MU with them. Now around 7-8 batches completed. It is going on very well. And some of the institutes has already established them entrepreneurship development cell in the colleges, and activities are already going on there. Before we make it mandate, the people have already started working. There is a very good positive sign which is we are receiving. And then similar way, computer skills, computer tools for Sanskrit. The Sanskrit teachers we are training at the Hyderabad. The Department of Sanskrit, University of Hyderabad, they did a computational tools for teaching and learning Sanskrit. They developed it with the Sanskrit teachers. Already around the 6 batches are completed, or 300 people, more than 300 people has completed, already completed. So that way, this is going on very well. I got the feedback from some of the teachers that they start extensive usage of computers now for teaching in the after the training program. Earlier, they never touched the computer. Now they started using extensively usage of computer for in the teaching. So that way, it has become a very useful tool for that one. And I used to send every first Friday on teaching technology article, and every third Friday research article. So far, we been able to disseminate 32 articles on the teaching technology and 26 articles on research articles. And we made mandatory because when they become principal, they should have some admission experience. So we have made mandatory. And also for faculties, either they have to go for medical education technology or quality improvement program, or at least once in 3 years. That is all a mandate. Now coming to curriculum and syllabus. Do we want to align our curriculum with the NEP 2020, which is widely accepted by entire country, the NEP 2020. And then the curriculum, the competency-based, as I told, the mandate of NCISM, the competency-based are one step ahead, outcome-based middle education. We could be able to bring it out, the first profession, second profession subjects well implemented, and the first year exams also over first batch, and we could be able to see the 20% hike in the results in the entire country. And the many universities where there is multi-faculty are there. So they're all, we received the very good appreciation. It was openly discussed in the academic committees. That was how our curriculum has been structured. It is well accepted and well appreciated as. Where we brought major changes, the theory to activity-based learning is 1:2. 1 hour you teach and 2 hours you go for the either practical training or activity-based learning. That way it has become. So we want it, as I told, multidisciplinary approach. The allied sciences, they were the isolated. We could not able to have integration with them. So to sensitize our people in the multidimensional way, we brought online elective courses in different fields are there. And then also to make this curriculum very simplified, attractive, edutainment, and then library hours extended, the recreation facility, physical education also, they're all brought into the timetable itself there. And then the structured curriculum, transition curriculum of UG and Samskara World program for PG, both has given very good results, very good feedback. And then we could able to see a smooth transition of the students to the main course. And these are the various types of lectures which you have included or recommended over these ones. I need not read all those ones. And then academic calendar. All of you may be knowing this year also AAP GTE. Many students could not able to get the eligibility for the AAP GTE examination. That is because of again non-implementation of the academic calendars. So that is the reason we want to bring it out uniformity across the country. So we brought academic calendar and implemented it. Because of this one, entire India we have at once examination. The batch is promoting same time. So when the NCSM batches comes, there won't be any problem for the students to implement any schedules because everything is scheduled appropriately then. And then academia and industry. The industry is a very potential industry which is needed of the for us also for practice, but we have kept a long distance between academics and industry. So we want to narrow down this gap. And then we had a meeting with the industries, and then they also really agreed to accommodate our students. There's the postings there. Now we are working out the postgraduate curriculum where we can have some time can be posted in the industry itself. That is, we'll be working out. And then content we have able to categorize the must know, desirable to, nice to know. And accordingly, we have made the blueprint also so that the must know will be up to 70% the questions comes there. So that they know, they study what to be known there, and they the same thing comes examinations. So there will be a synchronization of the theory and the importance and examination also. That way we will be able to do that one. And then first professional onwards, the clinical exposure. First year onwards, we had the clinical exposure as there. And then multiple options for the internship also we introduced there. And then examination coming to light but tight. That's what NEP says. The same thing we have adopted, light but tight. We have formative and summative. This is the first time we have formative also and summative also. And again, how to do the formative, how to do summative, we have very clearly defined. So that helps a lot for the students to focus on the must know category. And then double evaluation and no revaluation. So this again, many students are they wrongly understanding this one. So double evaluation, there are many times what happens now, the human errors were very common there. To avoid human errors, we have double evaluation. When double evaluation is there, the human errors will be minimized, totally minimized it. And so students get justification also. The structured viva, as I told, all of you teachers may be knowing that one. First students will be bombarded and last students will have no questions. This is something whatever you know, you tell and go. That is what generally it happens now. To avoid that one, we introduce structured viva. First student to the last students, same depth of the examination will be there for the first to last students. These are the evaluation methods, because when you have the theory differently, when you come to the practicals, we cannot evaluate only with one type of questions only. We need to have different types of the evaluation methods are there. So we have recommended the which problem, which content, how to examine it. That way we have given a lot of recommendations. And coming to policies and administration. The regulations and guidelines, for example, now. So we have notified MSc, Minimum Standards of Education in 2022, and then recognition of medical qualifications in 2023, national examinations 2023, and then minimum essential standards recently, the 2nd of the May, we notified, and then the guidelines for fee regulation of 50% of seats as per the NCSM mandate, and then guidelines for double evaluation. This all we have already well circulated. All of you well aware of all these ones. One second. And okay. One second, I'll be resharing this. Stop sharing and reshare that one. This will go. Is it visible?
Yes, sir.
Yes, sir.
It is visible, sir.
Yes, sir. Yes.
Now, then the Ashtanga Ayurveda, we had a lot of issues are there. Now, many people will going on writing selecting many definitions for each branch. So we make it official. We have made expert committee, and then we defined each branch what to be the exactly the deals there. For example, even Bhuta Vidya, even the people are wrongly thinking that the devils, demons, etc. Now we make it a clinical microbiology, even clinical microbiology, not only microbiology, clinical psychology and psychiatry. Agatantra, it was toxicology earlier. Now we made it clinical toxicology. Likewise, it was very clearly defined as per the objectivity of the subject. Now then, to promote the colleges to have the financially more viable, we made the intake capacity up to 150 or 200 also. The colleges which can willing to go for, they can go for 150, 200, so that they can financially viable also. Then the library hours extended up to 8 p.m. This also happens. Many principals I used to share with them. If the college opens maybe 9 o'clock, library opens 9, college closed by 5, library closed by 5. When the students get the time to go to library, so we need to extend the library hours at least minimum 8 p.m. that way. Then college council, student council, academic activities, all the different cells we have included. And then as per the UGC also, Government of India, some norms are there. The committee against sexual harassment, etc. Then teacher days. Earlier, when you see the inspection times, always head count is going on, happening, all these ones. And the many times it happens that one, many colleges will suffer once the inspection is over. Sometimes students are sent out, the teachers are sent out, or students, teachers may leave it. The whole year they may not be there. Again, inspection time, they come back again. To avoid all these ones, we may introduce the teacher days calculation there. That helps a lot for the teachers also to maintain, the college also to maintain constantly the teacher number there. HODs, when the two professors are there, sometimes one is in professor till the retirement, he will not going to be changed. And sometimes a junior professor, maybe in the age by senior, so he may retire early than that one, he never become HOD. So to facilitate that one, we made HOD and rotation basis there. Guidelines already told it. Then extended permission now. Now the colleges which have 3 years, the continuous permission, they'll get extended permission. And they every year, the counseling process, they can immediately go for it. There is no problem there. They can do it, that one. And rating. It is wrongly understood that people, the 100%, when the minimum norms are met out, they think they fulfill 100%. But 100% of minimum norms is passing mark only. It is 50% they got it. They just pass mark. So rating will be given over and above how much they are doing, what they are doing. That makes the rating. A grade means the after over and above 50%. For example, now we got first class is after 65 or 70%. Distinction is 75%. Likewise, over and above the minimum, what we do. So that gives the rating standards now. And then, okay, A grade, A and B grade colleges. So they have the facility to go for the newer courses, new admissions, everything they can do it. And then A grade colleges will be allowing 5% additional fee. They can collect it also. And also, we make that one A grade colleges can admit the foreign students over and above the sanctioned intake capacity. 5% supernumerary seats, they can be filled up. The sector will be shortly coming up. And then penalty and disciplinary actions can be timelines for existing colleges. These are already there in that one. Now coming to interdisciplinary approach. Different activities now. So online elective courses, as I told, so we want to have interdisciplinary approach for our students to sensitize in different branches. For example, even medical instrumentation, AI, which is very, very important, artificial intelligence is there. So likewise, different courses are there, which they can get exposed of. So the student can, tomorrow they can think of any innovations also. And again, similar way, we have developed the BSc Nursing Ayush module. And then Ayush module for intents of BA, MBBS people. And Ayush module for physiotherapy. And Ayush module for Mruga Ayurveda for veterinary science. So likewise, this all we are already, NCSM developed it, which some are already taken up, some are implemented else. Now, new initiatives promoting research and hand-holding. One is the major things as I told, we have stagnation about the samhitas are there. So we need to adopt all the advances which is happening in the scientific field. So for that, we have made now SME STD in our regulations. Accordingly, we had an expert committee also constituted, and the subcommittees are going to work it out. And then these each subject-wise committees, they identify which advances to be included at which level and what to remove from the existing content. This will be given by the these committees are there. Already the core committee, we had a meeting also, and then now the subcommittees will going to work it out now. And the restructuring of PG program, as I told, UG PG difference is not there. And we had a very tough time for the PG program to restructure it. And then luckily we got the very good experts there. IITs, they have the tradition or the practice of revising the syllabus for every 10 years. And that will be take for 2 years long procedure, they follow it. 8th year, they constitute a committee, which will again go for feedback, as we told, feedback, all this was restructuring and then taking opinions and then training that one. That way there is a 2 years process they do go in. Now we got the expert who are involved in that the process from the IIT Delhi, and then one Stanford under top 200 scientists who are listed out, one scientist we got it. And then likewise, the Vice Chancellor of the NIA Jaipur, that Sanjeev Sharma also come there. And we had some experts one day, a full day. Even MUHS, the curriculum, the MUT professor from the MUHS. Likewise, we got the right people, and the one day brainstorm session was conducted it. And then we could able to bring it out, they complete the restructuring of the program, where we'll be going to have semesters, then modules and credits will be going to have that one. That is going to come out. Already in the PG curriculum, the PG regulations comes out, they'll be notified and will be coming out shortly, coming out. And we'll be changing everything into credits now. So it will be international standards that we have credits in the PG program. Similarly, NCSM schemes to handhold our faculty members, publication grant. Already now the many people has received the publication grant also. We are releasing out those who are publishing in the index journals. The amount will be reimbursed it, they'll be giving. And then Anveshanam Rasabhasma. Anybody having the idea of thinking of, maybe I think the Dr. Yogesh Bendala, he prepared the platinum Bhasma there. Likewise, somebody wanted to prepare the Bhasma, they can think of, they submit the Anveshanam, NCSM will be supporting it for that one. And the CCR's collaborative schemes, the Spark UG, all of the principals may be knowing very well, PG Star, where the Spark only UG to previously 100, the next year 200, and the Star PG will be last year 100. This year 100 already announced it. They're going to give it, which is again a big boost in our sector. And Agni for the Agni and Smart also already announced it, going on happening that one. And then as I told, Prana, that is protecting rights and novelties of IASU systems. The national conference will be held in the 11th and 12th of this month. There were nearly 500 delegates is going to come. And we have taken the the AICTE collaboration, and there is the MIC, Ministry of Education's Innovation Cell. So those the collaborations, we are going to conduct the program, which will be a hand-holding the activity for those people. And then female graduate survey, some of the colleges are involved there. Our female graduates, many times it's happening that when, especially olden days, the PG graduates, so they will be getting married or they're not in the profession, many of them are there. So we are wasting 5.5 years of education and a huge investment from the institutions, the government, everything is being wasted there when they don't do the practice or profession, continue the profession. So we want to know what is the problem with them, how many people are practicing, how many people are not doing, what is the problem with them, why the people are able to do it also. Likewise, all these ones are being surveyed. Shortly, we may get the results and we will publish that also. And now the Swastha. Many times people think that Swastha, the equate the social preventive medicine, and wrongly understands the Swastha. Also, we want to see the obesity or the anemia or proportion change, like something else there. But Swastha is something different here from Ayurveda. So I also recommending them Swasthya health card. So where we can have, along with the investigations, we also can have Prakriti, Nadi, Sara, whatever parikshas are there. Sorry. So those can be taken, and then we can go for the advices as per lifestyle advice, as per Ayurveda, that can be done. So here Swasthya card. The cell prophylaxis. So when the seasons comes there, many people get the diseases. So we can bring along with Swarnabindu Prashan. We also can have for seasons, the prophylaxis can be started. That is given very good result wherever being practiced also. And then as I told, literature stagnation. So now we have already had a activity started to construct 21st century Samhita. So Jarak Samhita, Susu Samhita, all the Bhel Samhita, etc. After some time, some centuries onwards, there is no addition of information. Now we identified some experts there, so whom we think of they can do that contribution. So they are working out on the 21st century Samhita or Nighantus. And another major issue NCSM is facing is textbook quality assessment. There are many people writing the books without any quality, without any contribution, just the changing here and there and changing the order of the content, and ease was changing, and then publishing a book. And all these, the books are when they listed out the syllabus, every library will purchase. And so this is going and become business there rather than contributing to the science there. So how to minimize this activity? Then we brought out assessment scale, textbook assessment scale. So when you saw any book written by anybody, when we have to apply to us, and then we'll be taking experts' opinion, and as per the scale, they subject to the criteria, the assessment will be done it. When the quality is ensured, then only they will be entered into the reference books there. Otherwise, it will not be entered the reference books there. So that way, we have brought out textbook assessment scale. Presently, it is available in the physical form. Now we are developing the online portal for it. Once it is developed, I think today only I had received a phone call. They got the corrected one. Tomorrow I may have demo. Once it is a final, then we'll be opening to that one. Through the portal only, it will be done there. And then multi-author textbooks. Again, the same things. So many books are written there, and we don't have the newer informations and then the scientific information. For example, even higher genomics are there, which is a very important one. Which is how much of the even many drugs has been found out, many studies has been done out. They will not come it again to the classrooms. So we need to upgrade our things. So we wanted to have multi-author books with the latest information, which can have periodical editions there. So that way, already we floated for the first 3 year subjects. The request is very good, so that we already recommended to the commission, and that work will be taken up now. And then some of the students are going to the overseas countries for various courses or jobs. We are receiving the request for the transcripts. So there was a demand that to bring out a uniform or standard transcript there. Every university is giving their own transcript. There is getting a lot of confusion. The foreign people also requesting us which is correct, which is wrong, etc. Then we wanted to bring a standard transcript. We had some registrars and some experts meeting, and we could able to develop it for Unani Siddha also, and that is already available in the website also. And the major one for Rognidhana department is the laboratory diagnostic tests, how to interpret in terms of Ayurveda. Because now we may get the laboratory values which will have only prognostic value. For example, now the increased bilirubin indicates, okay, John, we make a diagnosis Kamala, but when you treat it, whether bilirubin is reduced or not, we are going to check that one only. But for diagnostic purpose, whether it is which Kamala, we may not able to use any test there. So likewise, how to interpret the diagnostic test in terms of our own things, how to use for them as a diagnostic purpose as well as the prognostic purpose also. So that way we had a committees, one core committee, one coordination committee, which they are working out on these ones. So then later on, we may develop the appropriate methodology for interpretation, how we can interpret these tests into our own science. There's some technological advancements. What is happening in that? One is the curriculum development software. As it is the first of its kind. Whatever the softwares on the name of curriculum are there, they're all curriculum implementation softwares only. There is no curriculum's development software which we could able to develop it. That's the reason second year curriculum we could able to have a very appropriate way. Earlier, first year, the syllabus subjects, we are manually doing that one. That time we had a lot of issue with the only counting itself for the main concern there. Whereas the second year it will come there, counting taken care of by the computer, and we could able to concentrate on the content. So that way, it has taken very good shape in the second year. So that way, there's NCSM the first one to develop a curriculum development software actually. And then learning management systems. All the principals are knowing that one. Unique Ayush ID for the last year we have given, this year yet to give it. Online electives going on well. Then curriculum implementation of capturing. This also we had a demo completed, and then shortly we may open it where you can prepare timetable itself and then capturing also. Both can be done through the learning management system itself. And the registration portal, some of you attended the various programs where we have the completely online portal we developed for the capacity building programs, all programs, so many activities. and then development of language processor compatible Ayurveda literature. This is again major issue. So we may have now all of you are using the chatbot. Dr. Anil Kumar, you are spoiling the screen. Dr. Anil Kumar, anyway, check it. Development of language processor compatible Ayurveda literature. As I told, all of you may be using the chatbot you are using. And now we come to Ayurveda, we may not get the appropriate information from the chatbot when you use the chatbot for Ayurveda information, because there is no database of our information in for the computer or chatbot to process. So that is a major lack. So then we thought we need to prepare a language processor compatible Ayurveda literature, so that even chatbots, all this can be process our informations and able to give whatever we wanted it. So that again we had an experts meeting, and then they're also working out on these ones. There is also one of the major issues going to happen, that one. And further, we are the virtual reality, augmented reality technology for the modern subjects are there. For example, you can walk through your lung, you can walk through your liver, you can walk through the heart functioning, we can see that one. That way, we have the reality ones of the VR or AR technology. But when you think of our own principles, for example, Dhatu Poshan Nyayas are there, the Kaleka Nyaya, Kedar Kulya, etc. So you don't have the appropriate these ones, or even our Samprapti. So likewise, wherever the process are there, so those things to show it, we don't have the technology. So we had again the experts meeting for this one. So we will be coming out with the AR, VR also for our own principles or our own the topics which are having the process there. Even the medicine preparation process, the Shodhana process, what is happening inside. Not in the Shodhana, Samskara, the 3 days Mardana is not required. What happens at the cellular level or the molecular level changes happening, that one. That want to show it. So that way we use the AR, VR. I think how. So these are all the changes of the things which you are changed it, and then what I told, there is a huge change in the sector. Also 20% result hike is not a small thing. We are getting very good result, and the students' feedback also very good. All the activities going on that way. Now the main thing is we need to work it out towards the change adapting. It means everybody wants change. Whenever we meet many people want, says we want to change. But when you brought the change, the same people resist sometimes. Many times the people resist, no, we don't want this one, we want the same thing anyway. But when you see the thinking, it may vary from individual thinking, institutional thinking, national thinking. For example, when a teacher thinks, see the regulation or anything they see, they think about themselves only, what benefit they are getting, what problem they are getting. They never bother about an institution. A principal there, he will bother about his own institution. And then when we sit here, we have to see entire nation. We think at the national level. When the NCSM is looking, they have to think at the national level. So individual thinking may vary. Again, institutional thinking may vary. Nation thinking may vary. So we need to think of, when we think from the NCSM point of view or anything which is implemented across the country, we need to think of the national thinking only. So we have to leave the individual thinking, and then institutional thinking we have to think. Every teacher has to think institutional thinking only. Then because the administrator has to think of entire institution, he can't think of only one individual. Then NCSM thinks the entire nation they have to think of. Likewise, we need to think expand our thinking to the national thinking there. Then we need to accept, adopt, implement, and then get feedback for the improvisations. Always get accepted, implement it, then we give the positive feedback. So by implementing this is happening, this one, then we can improvise that one. Otherwise, rejecting is there, so we will never grow into the further. As I told now, the blood sugar is the doctor cannot prescribe it. What they did is they gone to the one level up and then gone to the HbA1c. Likewise, we have to think of what we have to grow. Leave that one. No, today Katipasti will there, but tomorrow it will not be there with us. Then what we have to upgrade ourselves. That way we have to think of the progress. So let us join together to bring back the glory of Ayurveda by mainstreaming and globalizing. That what is the request to all of you. And then UOA is instrumental in this transformation. And as you quoted, Anobhadra Krutuvoyantu Vishwataha. So several novel thoughts came from various visionary people from different sector of the different sciences there. It is not our own individuals, but it is the entire collection of the novel thoughts from across the different sector of the people, the different sciences people has given, that become the all the transformation what we have done this one, the science of them. So my sincere thanks to all those visionary contributors also. I must thank at this juncture our Honorable Secretary and whose able leadership. Total the Ayurveda taken a different direction just taken. And then our chairman and all my fellow presidents and members, all the so many people who are all helped us. This one I thank my sincere thanks to, and also my members of my board and all those ones who helped it. Thank you all for patient hearing. Thank you very much. I'll stop sharing. Thank you very much.
Thank you, sir.
Thank you so much, sir, for your valuable presentation. It must been very enlightening and helpful for the participants for better understanding of changes in syllabus or various programs scheduled or made by commission. Now, moving to the end, I request Dr. K.K. Dwivedi, sir, Member, Board of Ayurveda, for vote of thanks.
Thank you, Shubhamji. First of all, I'm thankful to our chairman, Mr. Jayant Dev Pujari ji, our respected Dr. V.S. Prasad ji, Dr. Rakesh Sharma ji, Dr. Raghuram Bhatt ji, Professor K. Jagannathan ji, and all the members, honorable members who are present here. I'm thankful for their presence, their encouragement. I'm thankful to all the principal and the faculty members who are here from different parts of India, and they are actually benefited by this program, what we are conducting in this Samalochana, the first program of this, our 10 days program. Really, it is a time to think, to verify, and to act. I hope you all people will be with us, and we are going to change the reforms what what you want, and that is the real word and meanings of educational transformation for competent Ayurveda professionals. This is our duty, and I hope again we will meet on 5th in the same meeting with our new subject, that is the educational transformation for competent Unani, Siddha and Swarikpa professionals. Thank you all.
Thank you very much, sir.
Thank you so much, everyone, for your patient hearing, and our program is already scheduled, and all the schedule has been sent to you for coming programs. That is on 5th, we are having speaking by President Board of BUSS, and on 6th by President Member of Marbism on upscaling the standards of ASUS institutes. On 6th, confident practitioners, competent professionals, presentation by President and members of Verism. And on 7th, in morning hours, that is 11 to 1, it is on ISM undergraduation, presentation by Chairman NCISM. And on afternoon hours, that is from 3 to 5 p.m. On how to study ISM post-graduation. So all are requested to participate in further planned programs as scheduled. Thanking you from NCISM. Thank you all.
Thank you all. Thank you very much. Thank you all.
Thank you, sir.
Thank you.
Thank you, sir. Thank you. Thank you, sir.
Thank you, sir.
Thank you so much, sir.
Thank you.
Thank you, sir.
Thank you.
very much, sir.
Thank you so
Thank you,
much,
sir.
sir.
Thank you, sir. Thank you very much, sir.
Thank you, sir, very much.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Sir, thank